So I'm really pleased to introduce and moderate a little vignette that Dr. Allan Weiss and Tommy Santora, the patient, are going to present to you. And the reason why we're doing this is because we want you to be prepared when you go to your neurology appointment. And I'm sure you understand how important that is, but I want to point out that, and you probably know this, that medical appointments are really short, and you got to make really good, effective time while you're being in that examining room, and you really only have like 15 minutes tops. So you got to get stuff organized in advance, and it's really important that you sort of think through it before you get there. So I'm going to let Allan and Tommy do their dramatization, then I'm going to ask you to comment on this and tell us where they've met your expectations and where they haven't, okay?
Great to see you, Dr. Weiss. Thank you.
It's only been about a year and a half since we saw you last.
Yeah, I mean, about a year. I mean, things have been going fine, staying busy. Didn't really feel a need to see you, so I just kept canceling appointments, and now I'm here, I guess.
You're doing well then?
Yeah, I'm doing fine.
So I understand you've had difficulty in the past with double vision, eyelid drooping. How's that been going over the last year and a half since we saw you?
I can see real good up my good eye. That's good,
And last time I know you were here, you had a little bit of difficulty swallowing. How's that been doing since we saw you?
Swallowing's going fine. Yeah, yep.
No problem at all?
No problem at all.
Okay. And also, at times you were having slurred speech when you were here last time. How's that doing?
You can hear my speech is fine. It's good.
How is it in the evening?
It's perfect. Yep, speak well all day. My wife speaks a lot. If you can cure her speech. Oh, excuse me, Dr. Weiss. Oh, it's my wife. I got to take this. Hello? Oh, hey, babe. Yeah, I just made it to Dr. Weiss. I'm meeting with him. I got time to talk. He's good. He's got time. Yeah, I'm feeling fine. Did I take my list of questions for Dr. Weiss? Yeah, let's see. Okay, when will I be able to cut the grass, clean the litter box, do laundry? Yeah, I'll make sure I ask him that. Definitely. I'm not asking him that. Baby, I can't do that. All right, well, can I phrase it, have more energy, especially at night? I'm kind of shy about that. I mean, you might have to do all the work for a while. I'm just letting you know. All right. I'll ask him to prescribe something. All right, I gotta go, babe. All right, love you too. All right. God. She makes me want to pop a prednisone. She really does. Oh my God. All right.
So how's your stamina and fatigue been doing? Because last time you were here, you were having difficulty.
Is this between me and you and not me, you and my wife?
Yes.
Yeah, my stamina's great. Yeah, I have high energy levels. I'm doing good. Yep.
Mm-hmm.
Yep.
And the evenings you do fine as well? Or?
Evening, late at night, I do wonderful. Yep.
Okay.
Yep.
Now, you did bring your medication today.
I did. I have all my medication. Let me see here.
Let's see. You can bring one for me here. Let me
Sure.
see what you're on here.
Yeah.
So you're on Imuran. Looks
Yes.
like 150 milligrams a day. You're taking it every day as we tell you to?
Take it every day. Yep.
Okay. How about
So that's still the same thing. Sorry. All right. There you go. Prednisone.
and your prednisone? You're taking 10 milligrams a day.
Yep.
Do you ever miss a dose?
You want me to be honest?
Yeah.
Yeah.
Okay.
I kind of just take it as I feel. If I need to pop a prednisone, like I said, if the wife's nagging, I pop a prednisone.
Okay.
I put it in. If the boss wants me to do something, or I got to work late at night, yep, that's a good energy drug.
I think you're on Mestinon as well, I believe.
Right. So have you ever read the fine print on Mestinon? It says take one every 3 hours, shit every 5 hours. Have you ever read that? Isn't that awesome? So here's my anti-diarrhea medicine, so I kind of take that as a combination. So, but yeah. Now everything's going well. I just line up the pills. Sometimes I take them, sometimes I snort them. I'm good. I'm good. Good to go for the day.
So how much Mestinon are you taking?
About once every 3 hours. Yeah. In the bathroom. Yes. Yeah.
Are you right on are you taking it consistently every 3 hours or?
Like I said, as I need it, I take it. But yeah, it's about once every 3 hours. Yep, definitely. Okay. Eye starts to droop, I take it.
Okay. Now, another thing I noticed, you're on Imuran,
Mm-hmm.
and we've not received any blood work in a while.
Yeah, I don't like that stuff. Yeah, that means there a need for me to do blood work every now and then?
You know it's important. Blood work,
I know.
side effects.
I know.
that
There's
can
a lot
be-
of stuff I should be doing. Yeah, you're right. Okay.
All righty.
I'll get back on it.
Okay. And the other thing, you had your thymectomy about 8 years ago.
Mm-hmm. Is that still in here? That
Is the what?
did you take it out?
Yeah, we took it out.
Oh,
You had-
okay,
you-
good.
you
Okay.
had a-
How am I doing?
You had a thymectomy.
Oh, right,
And we
right.
found a thymoma when we were there.
Okay, good.
So every so often we have to monitor your chest X-ray to make your CT of the chest to make sure
Okay.
it doesn't come back.
Gotcha. Okay.
You were supposed to do that about a year ago, I believe.
Yes, I missed that too.
You missed
Sorry.
that too?
Yeah, you can
Okay.
add it to the list. I apologize.
Okay.
Yeah, it's tough. I mean, I'm gonna be honest with you. It's tough. Yeah, take all these pills.
Mhm.
Deal with
Now-
work. Deal with the wife. Yeah, it's tough. Yeah.
Okay. Now, I know you had some questions for me.
Yeah. Oh God, where do I start? All right, let's see. All right, so my buddy Mike took me out the other night. So we had a couple beers, 2 or 3. By the time it was two in the morning, woke up with this massive headache. That's got to be MG related, right? That's got to be. Am I right?
Probably not.
No. Okay. All right. So, okay. Here's another one. My wife, she talks. She talks a lot. Cannot understand a word she says. Have trouble listening. MG related? Is there another pill bottle I can take for that?
Yeah, I'm not sure there's anything for that as well.
Okay.
Sorry.
No. Okay. Yeah, that's all I got. I mean, that's my issues. I was just wondering if those are MG related. I try to just say it's because of my MG.
So, Tommy says the things we need to do. I mean, your myasthenia is not optimal. We know that right now.
Right.
I mean, you're having double vision. You're having your eyelids are drooping. You're having some fatigue and other symptoms. I mean, the first thing is you got to make sure you take your Mestinon consistently, not whenever you think it is.
Okay.
Because if we don't do that, then we don't know. You're hitting a moving target, so you really don't have a good idea what we can do to adjust things. And then with the Imuran, of course, again, we have to monitor that because we have to worry about your blood counts. You have to worry about liver failure and things like that where, unfortunately, I've seen patients that don't do that and you wind up having problems with it.
Yeah, I understand.
And then the other thing is you've had the thymoma, and even though it's been 8 years and you've done really well with the thymectomy, sometimes it comes back even when you might not really expect it to come back.
Right.
So we do want that monitoring every couple of years, at least once you get out a certain time.
Okay. Sounds
Okay.
good. Sounds good.
And then, so I want you to make sure you take your medications consistently. Don't skip the day of prednisone whenever you want to take it, or take an extra one.
Right.
And what I want you to do is in about a week, give us a call back,
Okay.
okay? And we'll report on how you're doing. And then we'll make decisions if we need to make additional adjustments after that.
Okay. Sounds
Okay.
good. Yep, I can
Okay.
do that.
All righty.
Thank you, Dr. Weiss. Appreciate
All right,
your
you
time.
take care.
Okay.
All righty. In preparing for a neurology visit, the first thing is education. So everyone who's here, obviously you're gaining education with respect to the disease, which is critically important because the more you know how to observe. I mean, in my mind, in looking at 20 plus years of taking care of patients with myasthenia, the patients who can feel that they can control their disease rather than letting their disease control them do better overall, by far. They don't get as overwhelmed. And understand, early on it's very overwhelming, this new disease you've never heard of, but it's very important to get yourself educated and to understand that we can control this to the best we can. So in terms of things, you need to know what your particular MG symptoms are. Not always, but very commonly when patients are doing well and they have difficulty, they may, ptosis may be their first symptom that is their first hint that they may be having their symptoms come back. Be aware of that. You don't need to perseverate on every symptom, but at least be aware of that. I think keeping a daily log, I think, is very important because what we're looking for when you come into the office is looking for a pattern. If you can tell me, I have patients say, at 5 o'clock every day, that's when I do really great till 5 o'clock and I then kind of peter out for the rest of the day. Well, we may be able to make medication adjustments, maybe increase the Mestinon or whatever, in order to basically help you through the rest of the day, where earlier in the day you don't necessarily need it. One of the keys is you need to have a list of all your medications. Now, with electronic medical records, it's becoming easier, but not only your list of medications, but know what you're taking and take the dose that you're supposed to take. Because when I have patients that occasionally will sit there and change their medications all over the place. Well, you have no idea. You kind of guess what you think is the best, that might be the right dose for them, and then slowly adjust it. But you can't hit a moving target is the problem. If we've made changes in your medications, how has it changed your myasthenia? For better or for worse? very important. The blood work, as Tommy didn't do, but I'm sure he does in real life, is you need to complete your monitoring blood work. It's inevitably the patient that doesn't do the blood work is the one that we find an abnormality when we do it. Amy and I like to get even patients who are on maintenance doses every 2 months, getting blood counts and liver function tests at the very least. Patients with thymoma, you should be getting CT the chest basically for the rest of your life. Maybe every other year, but you should be getting it because it can come back long after you would expect a thymoma to come back. In terms of questions, prioritize yourself. Understand, especially if you're going to a neuromuscular subspecialist, that's what we're concentrating on. Doesn't mean we can't talk about your other diseases, but that's what we're concentrating on initially. So organize your questions in a manner that makes sense. One of the things you can do, and you should be doing this when you are having symptoms every day, to get a pattern, why am I still having the myasthenia symptoms? I have patients that call me between visits. Remember, we see you 15, 20 minutes every 2, 3, 4, 6 months, but your disease is all the time. So things you need to make sure, are you taking your medications as you're prescribed? That's very important. Number 2 is, have you started new medications? Because unfortunately, even pharmacists mess up once in a while and say, oh, no problem taking this with myasthenia gravis, and they in fact do have adverse effects for myasthenia patients. Are there any new medical problems? Do you have new thyroid disease? Well, that may impact your disease. Are there other things that are going on that may give us a hint as to why you may not be feeling well, may be unrelated to the myasthenia? Any recent infections or recent procedures, those can have an effect. The infection and also the antibiotics they give you could theoretically affect your myasthenia. Has your activity level changed? I have patients say, well, I'm no better than I was before. Meanwhile, instead of their level of activity